So good morning viewers, my name is Dr. Supratik Bhattacharyya. I'm a consultant endocrinologist based at Kolkata. I'm the director of SKN Diabetes and Endocrine Center, Noihati. I also have a practice which is established at Apollo Clinic, Newtown and Salt Lake, AMRI Salt Lake, and also associated with various branches of Suraksha. So today we're going to talk about the treatment modality of type 1. So many of the younger individuals who come to us less than 10 years may be type 1 diabetic patients, and we do the antibodies to diagnose. And if the antibodies come back positive, we know that they are type 1 diabetic patients, and the implication is that they would need to stay on lifelong insulin treatment. The reason for that is the body does not have enough number of insulin secreting cells because those antibodies goes and destroys those insulin secreting cells. Now the other aspect would be, or the other spectrum would be the type 2 diabetes, where we have an entire different spectrum of treatment or management plan just because of the fact that we do have enough number of cells in our body which secretes diabetes in the first place. Now we have a whole lot to choose from in type 2 management, and as we had discussed before, the treatment is entirely customized based on the need of the individual. So we might need to start you on a medication, but in rare circumstances we might need to give you some injections as well, which would include insulins or non-insulin injectables, which are also our own body's hormones. Now let's start with the medications that are available for diabetes management in type 2 patients. There are lots of groups, but the idea is either to facilitate the function of insulin that comes out in the body, or to decrease the insulin resistance which is causing problems with the insulin action in the first place. We also now have got a very advanced treatment modality for type 2 diabetes. Some of them are injectables, of course, but they have the added advantage of not causing any hypoglycemia or sudden reduction in the blood glucose levels, but at the same time have got sustained blood sugar, maintains sustained blood sugar levels, and also does not increase weight. We have certain molecules now which not only controls your blood sugar, but at the same time in obese or overweight individuals cause weight loss. At the same time, we can also target other parameters which are badly affected or adversely affected because of diabetes. The whole idea, as we said, of treating diabetes is to prevent complications later on in life, and some of the complications that we talked about is that of the kidney problems, the problems with your nerves in your hands and feet, or the back of the eye or the retina. And these kinds of issues are well sort of addressed by these new modalities of treatment. So the diabetes management now has become very easy and customized based on what is your need. So we now have therapies which we can use just once a week. For example, we can give you something every Sunday, and then you forget about taking medications for the entire week and then take another dose the next week as such. Very soon we are going to have the convenience of treating diabetes once in 3 months or once even in a year or something. So it is as good as putting the diabetes into remission and the convenience of having lesser frequent medications. Hope this entire series of educational videos has been helpful for you, and if you like the video or if you would require any additional information, make sure that you click on this link below. So thank you, and I sign off here. Thank you so much.